Welcome to today's webinar, Creating Healthy Places for Healthy People, hosted by the Smart Growth Information Clearinghouse. My name is Michael Bayer. I'm the Manager of Infrastructure and Development at the Maryland Department of Planning and Project Manager for the Smart Growth Information Clearinghouse. The Smart Growth Information Clearinghouse is a project of the Smart Growth Network and is partially funded by the U.S. EPA Office of Sustainable Communities and managed by the Maryland Department of Planning. In addition to hosting webinars like today's Creating Healthy Places for Healthy People, the Smart Growth Information Clearinghouse has a website, smartgrowth.org, which is your one-stop on the web for the most current information on effective growth, development, and preservation practices. We provide timely news and information about events, funding opportunities, awards, and resources to help local decision makers foster healthy, resilient, and economically vibrant communities. The Clearinghouse is also the virtual home of the Smart Growth Network, a nationally recognized coalition of leadership organizations that have formally endorsed the principles of smart growth. This webinar is one in a series of webinars produced by the Clearinghouse that are available for viewing at smartgrowth.org. We're recording this webinar and we'll post a link to it on our website. We encourage you to visit the smartgrowth.org website and subscribe to our weekly e-newsletter to get the latest nationwide information about planning and smart growth and to learn about our upcoming webinars. You can also learn about other planning activities and educational opportunities in Maryland by visiting the Maryland Department of Planning's website at planning.maryland.gov. Viewers of this live event are eligible to receive 1.5 CM credits from the American Planning Association. To log your CM credits for this webinar, log into your account at APA's website and search the name of today's event, Creating Healthy Places for Healthy People, or event number 913-6629. This webinar has been approved for 1.5 CM credits for live viewing only. Today we are excited to present Healthy Places for Healthy People. In today's webinar we will be discussing the connections among economic, human, and environmental health factors and present case studies on the lessons learned as well as ideas on how local communities can create programs and partnerships that can lead to healthier community outcomes. Today we are pleased to present 4 speakers: Kate Angie, Stephanie Bertina, Alana Brazier, and Caroline Dwyer. Kate Angie is Vice President and Managing Principal with Renaissance Planning Group and is based in Arlington, Virginia. She has served as Project Director for the Healthy Places for Healthy People Technical Assistance Program on behalf of EPA and has also led many other EPA-based technical assistance programs nationwide around topics and issues such as local food needs, infill development, equitable development, and small town and rural planning. Stephanie Bertina is a Senior Policy Analyst at U.S. Environmental and Protection Agency. She provides technical expertise and assistance to communities across the country that are seeking to build vibrant, healthy, and sustainable neighborhoods and downtowns. At EPA, Stephanie leads the Healthy Places for Healthy People program, a multi-agency federal initiative that helps cities and towns partner with healthcare facilities to support local economies and to create walkable and healthy communities. She has also led the Local Foods, Local Places program, helping more than 90 communities across the country leverage the power of local food to restore main streets and create economic opportunity for all. Alana Brazier is a project manager with Renaissance Planning based in Tampa, Florida. She serves as project manager and lead facilitator for the current round of Healthy Places for Healthy People projects. Alana has diversified experience in community planning on a range of issues related to sustainability, community development, and multimodal transportation. Finally, Caroline Dwyer is a senior planner with Renaissance Planning based in Durham, North Carolina. She serves as a senior technical lead for the current round of Healthy Places for Healthy People. Caroline's academic and professional experience in the areas of sustainability and resiliency have given her a unique understanding of these concepts and how to incorporate them into planning. Following the presentations, our presenters will answer as many questions as time permits. You can ask a question anytime during the presentation by using the questions tool in the control panel located on the right side of your screen. Now I'll turn it over to Kate to get us started.
Well, good afternoon, everyone. Happy to be here and kind of start talking about this, what I'm going to call a new integrated planning way of looking at our communities. As Michael introduced us all, we are going to kind of walk through 4 key areas today in terms of our presentation. I'm going to kick us off with just a little bit of history. How have community planning and public health come together over the last 100 or so years? Alana's going to talk to you about partnerships and projects for creating healthy communities. Stephanie's going to give an overview of the Healthy Places for Healthy People program and the technical assistance that's been provided by EPA. And then Caroline's going to give us a little bit of a insider's look at what that action planning is in terms of technical assistance on the ground with communities. So I'm going to start with a bit of a history lesson just to kind of remind folks that this topic of health and city planning has some pretty deep roots. Most of our city planning in America really began as a response to some concerns about public health, whether it was the need to create green space, promote physical activity, as our cities were really losing green space and rapidly developing and becoming very urbanized. It also was dealing with really the prevention of infectious diseases, and that was by providing clean infrastructure or for clean water and sewage systems. And what we are probably most familiar with in kind of the last 100 years is a lot of initial emphasis on kind of creation of zoning was really about separating uses in terms of making sure that where people were living and kind of the hazards of this new industrial city were not creating more, health problems. So our connections between city planning and public health really run pretty deep. If you think about how our cities then transformed over the next 50 or so years, a lot of good things did come out of that integration of those two fields. And what we saw is because we started planning cities with public health in mind, we also were able to mitigate some of those early negative impacts of industrialization. And as a result, however, we also saw kind of the two disciplines kind of move further apart. So city planning kind of went on its track and public health kind of went on its track, and the two really kind of separated themselves over the next 50 some odd years. What's interesting though, as America then continued to grow, and particularly with the advent of the suburbs, we really started to create new patterns of development outside of our cities. Those patterns were really dominated by car-heavy patterns, if you will, or auto-dominated patterns, and that started to raise new concerns that got on the radar of our public health officials. One of the kind of most pressing issues that really came to a head, I think, in the 1990s was the recognition that this pattern of development, which is pretty much a traditional suburban development circa 1980s and 90s, was really creating a rapid increase in vehicle miles traveled. And vehicle miles traveled, as you all know, is simply a measure of how far and how much we drive on a daily basis. As a result, there were concerns being raised that the amount of increases in VMT were going to create and exacerbate really our issues with air quality. So that was kind of a flag up, if you will, that was bringing the public health sector back into the city planning world. In addition, those same patterns of development were also creating conditions where most people were living a fairly sedentary lifestyle. That was being correlated with, across the nation, increasing rates of obesity and diabetes. So all of a sudden, we had facing us as public health officials and city planners the recognition that how our communities were being designed and how our lifestyles were kind of responding to that was creating some significant new health concerns. following that, and really in the last probably 10 to 15 years, it's really become obvious in a lot of places that if you start to map through GIS and other ways, kind of the health of our population back to the location and start to analyze those statistics, some are really calling out now the fact that your zip code may be a more direct determinant of your health than anything else. And this has really prompted folks to take a hard look at the social determinants of health and start to better understand how that relates to the built environment, the health of the economy, the health of the natural environment, and what can be done to maybe intervene so that we don't see such disparities between public health outcomes and where people live. So what's happened of late is our public health folks and our city planning practitioners are coming back together and trying to tackle this problem as kind of an integrated approach to really focusing in on what we call healthy community design. And there's been a lot of work done recently in this area. What you're seeing up on the screen is kind of one of the initial kind of listing of healthy community design principles, and this comes directly out of the CDC and APA's Healthy Community Design Toolkit. And if you look at these principles, what's pretty interesting is this correlates fairly well to the smart growth principles. And so you're really seeing what I would call a synergy of how we are thinking about smart growth and how we're thinking about improving public health under this bigger umbrella of healthy community design. So if we think about what we mean by healthy communities, what are some of the key components? We have really taken this approach, and you're going to hear a lot about this in the presentation on the EPA program, of how do we really look at what it takes to create healthy people and healthy places where there's ample opportunity. That really combined is what will create a healthy community. We know that there are several kind of factors that really can lead to premature death or shorter lifespans. What's interesting about this graphic is we've got kind of access to healthcare, we've got genetics, we've got individual behavior, and those social and environmental factors. Well, what we know is that we can't really, as city planners at least, deal with the genetic side of things, but everything else on this diagram, actually, we do have an influence over. And this is really what's become kind of the centerpiece, I know, for our work in thinking about how we create healthier communities. The social determinants of health are kind of, you know, these 6 areas. So you've got the economic stability. Do people have employment? What is their income level? And how does that contribute to their access to opportunity and health care? What is the physical environment of where people live? Education, access to food, the community and kind of social capital in areas, and really the access to and quality of the healthcare system. So if we start as city planners thinking about these social determinants of health, you can really start to see where we can play a role in helping to contribute to healthier communities. So if we want to define what is a healthy place, it's a place that really is intentionally built to improve the quality of life for all people who work, who live, who play, worship within kind of their community, where people have choices to make in terms of the variety of you know, health options, transportation options. All of those sorts of things are available, they're affordable, and they're made available for people so that they can live and have opportunity to have healthier lifestyles. If we think about how communities then and how we as city planners can really contribute to the creation of healthier communities, it's by taking a more proactive role in how we invest, how we shape our policies, and where we make our investments. And the goal of kind of this umbrella of healthy places for healthy people is to create more vibrant communities, healthier economies, and that therein provides kind of opportunity for people to live the healthiest lifestyle and have better health outcomes. So if we think about individual health, which is at the center of this diagram, and then at the very kind of outer ring is the health of the community, and the question is, how do we actually start to build healthier communities that can reinforce healthy economics within a given place? One thing that we know is that without a healthy job base to sustain living wages, we really can't deal with health very well. So what this diagram is meant to reinforce is that creating healthy communities is also about creating kind of the economic positioning for growth and economic development. So with that, I'm going to turn it over to Alana to talk a little bit more in detail of what some of the partnerships and projects for creating healthy communities might look like.
All right, thanks, Kate. So Kate did a really great job of teeing up and framing up how health and planning are so integrated. And what I'm going to go through is discussing how we've seen communities across the country implement this and bring together health and planning, and how important partnerships are to getting these things done. So just to start out with, who are the primary health partners? Of course, we're talking to a bunch of planners today, mostly, but there's really the primary health anchors are hospitals and federally qualified health centers. Those are the two anchor institutions that really have a vested interest in seeing that the people that they serve and treat are able to live their healthiest lifestyles, and they're starting to understand that connection between the healthy place and getting into the social determinants of health. Creating healthy places brings the whole idea back that they can create, help facilitate healthier people. So, but it's not just them, it's not just the anchor institutions, there's also a whole bunch of other related health partners. There's, of course, public health departments at county levels. We've seen YMCAs really get into health and community engagement, area health education centers and organizations, and many, many others. But we're also seeing now non-traditional partners engaging in health planning, such as local governments, MPOs and councils of government, and development and planning councils. So I'm just going to highlight a few examples that we've seen from communities across the country. I'm going to organize it around these healthy place objectives, which basically match up to the social determinants of health. So starting with neighborhood, in La Crosse, Wisconsin, the Gunderson Health System worked with the city to develop a joint neighborhood and hospital campus plan. The location of the hospital was in a neighborhood that had seen some disinvestment over many decades, and they saw an opportunity to kind of step outside their typical role as just a healthcare provider, and to step into helping create a healthy community, especially for those people living in the neighborhood in which their hospital was located. So they created this joint neighborhood plan, and it had a whole bunch of different elements in it. Just some of the interesting things that were tied into that, they created some new medical resident housing. So the new medical residents were able to live within the neighborhood, start to feel a tie to that place, the neighborhood, and La Crosse. They had housing incentives for people their employees to purchase housing within the neighborhood. They also helped create a healthy living center with the YMCA. grocery, multi-use trail, just really creating this whole scale neighborhood that had all these different healthy community aspects. And one of the interesting things they also did was create a TIF district with the hospital and the surrounding neighborhood, so that tax increment revenue that was generated within that tax district or TIF district was then put back into the community for improvements like the parks and trails. And then moving on to active living and transportation, another interesting thing I wanted to highlight was the availability of multimodal access to people who might not be able to easily buy a bike or maintain a bike. And this is an example from Bishop, California. It's a very small city located east of the Sierra Nevadas. And the Toyabe Health Center received a grant to place 2 bike share stations within the community. They placed one at their health center, and then about a mile or 2 away, they worked with the city to place one in the park. So it allowed people to easily access these bicycles and get around town. When it comes to access to healthy food, one example we've seen, which is in eastern Kentucky, was this Mountain Comprehensive Health Corporation. They're the federally qualified health center that serves this eastern Kentucky area. So they partnered with the Harlan, which is the city that they were working with, the Harlan Farmers Market, and they created this pharmacy program that allowed their patients to receive a stipend that would then go towards purchasing healthy food at the farmers market. So they did have some qualifications for patients, whether they had type 1 diabetes or were pregnant, or were patients with diabetes, obesity, or hypertension, and then also fall within 100% under the poverty guidelines. So what they received was $1 per day, so they could receive up to, I think, $35 per week. And they redeemed it at the farmers market, which they described as a win-win-win. So the community received better access to healthy food. The farmers had a guaranteed source of income at the farmers market every day. And then the healthcare provider, the federally qualified health center, also saw a win because they're seeing improvements in the people that they're serving because they're able to access healthy food more easily. When it comes to economic stability and job creation, in Spartanburg, South Carolina, the Spartanburg Regional Healthcare System, which is a hospital located in the North Side neighborhood, worked with the city on this North Side initiative, which was a large-scale neighborhood revitalization effort. And what they did was create, one of the many things they did, was create a workforce development program where they provided workforce training to residents within this North Side neighborhood. So they created this training program for people who were interested in a health career. They also provided scholarship opportunities. They streamlined the application process. So whenever a new opening came up in the hospital, North Side residents were able to be the first ones to apply to that before it was opened up to the broader city. They also created a construction apprenticeship program that where people were able to get training at working at the hospital, and then were hired to help with construction projects that were happening within the neighborhood that were part of the revitalization efforts, and also an entrepreneurship program that gave $5,000 stipends to people who participated in a program and won a competition. When it comes to access to healthcare, one interesting thing that we've seen is called the O Positive Festival, and this is actually a group that puts on festivals across the country. I think they've done it in several cities now. But what they do is help work with the cities and local health partners to put on one-day or weekend-long festivals where they have artists who are underinsured, artists or musicians. They create and perform their art in exchange for medical and dental services. So it's a win-win for both sides, and then also the community benefits by being able to go out to this festival where there's art available to them. When it comes to community and social support, one thing that we've seen is the provision of mental health services located in a downtown. This was in Greensboro, Alabama, the Project Horseshoe Farm, which is led by a doctor who works at the Hale County Hospital, but this is his side project nonprofit. So they provide mental health services within this old renovated hotel right in Main Street downtown. They also provide adult daycare, so they have activities for anyone in the community who just needs something to do during the day. They also have after-school care programs from pre-K through high school. So it provides a safe place for people to spend time, meet other people in their community, and just feel like they're a part of the community. And then lastly, on education. So aside from the typical way we think of education, which is equally important with primary education and secondary education, there's also the education side of letting people in your community know what resources are available. Many times there's a ton of resources available, people just don't know how to access it. And so what we've seen in Hale County, Alabama, is the county public health department created this really comprehensive resource guide that lists all of the different resources available to people, including health, but also transportation, social services, workforce development opportunities. And they're in the process of creating an app so it's even more easily accessible to people to find out what's available to them. And so in all of the examples that I highlighted, partnerships are really key. And creating healthy communities requires that cross-sector collaboration and defining that collective vision of where the community wants to head. And this example that I'm showing is from CDC's Community Health Improvement Navigator. They have a toolkit that is available for communities to go through this visioning process, to bring all these different stakeholders to the table, to assess what the current environment is, how healthy are people, what can we do to improve the health of our community through these physical changes and community changes. How can we implement it? And then are we achieving what we set out to do? And there are a whole bunch of other resources and toolkits out there. These are just a few of them. But there are a lot of different toolkits out there for communities that are looking to implement anything like that collective vision I was just talking about, health in all policies, other things like that. And then there's also funding opportunities, and not just through your typical health partners and health organizations, but also through USDA, FHWA, the Small Business Administration. There's just a lot of opportunities out there for communities that are interested in having support in creating healthier communities, partnering with health organizations and other partners like hospitals and federally qualified health centers. And what Stephanie is going to get into is how we've done that through the EPA's Healthy Places for Healthy People program.
Good afternoon, everyone. I'm happy to be here. As Alana said, my name is Stephanie Bertina, and I am with the U.S. Environmental Protection Agency based out of Washington, D.C. And I think Kate and Alana did a really great job sort of setting the stage of where we've been in terms of the intersection between planning and public health, and some ways that communities across the country have started working on addressing the social determinants of health in a really comprehensive way. And what I wanted to do is just to share a little bit about our Healthy Places for Healthy People program that was in response to a lot of the trends that Kate and Alana have mentioned. If you know anything about the Environmental Protection Agency, you might know that our mission is to protect human health and the environment. And our office at EPA, the Office of Sustainable Communities, has recognized that where and how we build our communities impacts our ability to protect human health and the environment. And so we've been working on how the built environment affects people's health and the environment in which we live. So my office at EPA, the Office of Sustainable Communities, partners with communities that are seeking to build neighborhoods and downtowns that are healthy, walkable, and economically vibrant places, because we realize that we cannot protect human health and the environment without doing so. In our 2 decades of working with communities, we have learned that some communities really need the time and space to have a conversation about the future of the places where they live. And that's where some of our technical assistance, our planning assistance programs have come into play to work with those communities so that they can create that common vision and strategies for achieving what they want for the places where they live. And over time, we've heard communities ask for help in improving environmental and human health outcomes, in building stronger local economies, in expanding opportunities to live healthy lives, and to revitalize their downtowns and neighborhoods. So we've worked in hundreds and hundreds of communities across the country on a range of programs through our office. We've worked in small towns to large cities on a really wide range of issues. We've partnered with communities to help them leverage local food systems in their communities. We've worked to help them take advantage of broadband internet access in their communities. We've worked with communities on designing neighborhoods that are going to be more healthy and allow them to thrive. We've worked on green and complete streets projects and on flood resilience. If it touches the built environment, we've pretty much worked on it. But one area that we hadn't really explicitly worked on is the role of healthcare facilities in downtown redevelopment. So what's unique about the approach? In all of these places where we've worked, what makes it different? I think one thing that we provide is access to planning assistance. As I said before, we've heard in our work with communities across the country that sometimes communities just need access to the time and space to have a conversation and access to examples of best practices from around the country. And so we've been able to provide communities with this planning assistance. All of our technical assistance programs have really simple applications. The barriers to entry are really low, which allows us to work with communities that otherwise wouldn't have access to this kind of resource. And we have the benefit of learning by working alongside of the communities that we've worked in, and we can then elevate the success stories that we find out about, and we can help develop tools that can be used by other communities across the country. We've also seen that our programs have attracted significant investment from other agencies and partners. Our technical assistance approach involves inviting federal agencies to the table to listen to communities' needs and then respond in kind with implementation support to see how our programs can help support the community's visions for themselves. And we also know that oftentimes public sector investment spurs private sector investment, and we've seen that in many places where we've worked through our various programs. So one community where we've had the pleasure of working with over the years is Williamson, West Virginia. And I wanted to take a moment to share a little bit about Williamson with you, because Williamson was really the inspiration for starting the Healthy Places for Healthy People program in many ways. Williamson is in the center of coal country and in the heart of Appalachia. It's a community that's experienced a lot of disinvestment over the last several decades as the coal industry has declined, and they've seen a lot of economic and health challenges as a result. But Williamson has really taken their challenges and turned them into opportunities. And we were able to work with Williamson through our various technical assistance programs over the years to help them think about how they can create a culture of health in their community, rather than one that is marked by economic decline and health challenges. They wanted to spin their challenges into an opportunity. And so with the leadership of a local doctor and a team of people who were working with him, the folks in Williamson renovated a vacant building on Main Street in their downtown, and they chose to locate a federally qualified health center there. And they did this intentionally so that the health center could become an anchor and a catalyst for revitalizing their downtown, for improving people's health and improving people's lives. And the Williamson Health and Wellness Center has done a lot of things. They've facilitated a community garden, which you see pictured here, and they have a downtown farmers market. They have a mobile market that takes farmers market produce to people who can't access the farmers market around the county. Like the pharmacy program that Alana spoke about earlier, they have a prescription vegetables program that allows their patients to have access to fresh, healthy food. They have a health innovation hub that provides space for budding entrepreneurs in the health and local food sectors as they're getting started with their businesses. And they support a variety of active living programs and nutrition education programs that have improved their patients' lives in a holistic way. And what we saw with Williamson was that health can really be an organizing force and a catalyst for economic development and downtown revitalization. And that made us wonder if other communities around the country wanted to do something similar and if they needed some help in getting there. And that's really where we developed the idea for Healthy Places for Healthy People. And what this program is really all about is providing planning assistance for community leaders and healthcare facilities. And this could be a community health center like was the case in Williamson, or a nonprofit hospital, or another health partner, who really want to work together to create healthy, walkable, vibrant neighborhoods and downtowns. And what we're aiming to do with Healthy Places for Healthy People is allow communities to come together to address the health concerns in their community in a holistic way, to recognize that healthcare facilities can be anchors for neighborhood and downtown revitalization. Oftentimes in many communities across the country, the healthcare sector is one of the key employers in a community or a region, and they can also be this sort of catalyst for downtown redevelopment if they're located in a place that allows them to do that. We also have been working with communities to improve access to healthcare, to fresh food, to physical activity opportunities, to support health-focused entrepreneurs and businesses, to create jobs and create opportunity out of the lens of health. And of course, to make improvements to the built environment so people's everyday lives can enable them to live healthy and active lives. So our pilot year for Healthy Places for Healthy People, which just concluded recently, and we had EPA with a partner as well as the Appalachian Regional Commission. We worked with ARC to support 3 communities out of our 10 pilot communities this year. And we also had help from other federal partners, including the Health Resources and Services Administration and the Centers for Disease Control and Prevention. And our model of technical assistance, as I said before, is really bringing together the federal partners to the table, to a convening in each community, to listen to what they are hoping to achieve in their communities and to see how we might be able to be a part of that implementation moving forward. So as I said, we got to work with 10 communities this year through our pilot program, and it was really an amazing year of learning. And we worked in small towns, we worked in large cities, we worked with a nonprofit hospital in Monette, Missouri, for example, to improve walkability and create additional housing options downtown. We worked in small towns in West Virginia, Montgomery and Smithers, to create new economic opportunities and options for community members to live healthy lives. We worked with a federally qualified health center in Nogales, Arizona, on the U.S.-Mexico border, to help them make plans for a new downtown location for their health center. So we really worked on a broad range of issues that touch on people's health and on leveraging the power of health as a catalyst for downtown redevelopment and for creating healthier communities. So it's been a great year of learning. And where are we going next? We're right now compiling our lessons learned from this pilot round, working with these 10 amazing communities. We have another round of assistance planned for next year. We closed our application period earlier this fall, and we'll be selecting communities to work with in the next round sometime early in the new year. So please do stay posted to our Healthy Places for Healthy People website for more information if you're interested in this program and what we're learning. And I think with that, I will turn it over to Caroline, who will dive a little bit more deeply into the technical assistance approach and what we've learned in some of our partner communities.
Okay, thanks, Stephanie, and thank you, Kate and Alana, for setting everything up so well. So I'm going to briefly describe the model that is used by EPA for the technical assistance programs that we facilitated, and then talk a little bit about some of the on-site activities that we conducted with the communities that we worked in for this first round of pilot communities. So the technical assistance approach that we used for Healthy Places for Healthy People is a fairly well-vetted three-phase process that has been used for a variety of other EPA technical assistance programs, such as Local Foods for Local Places and Building Blocks for Sustainable Developments. And I will just quickly walk through each of these three phases and describe sort of what we hope to get out of each of those and some of the activities within them. So the first step here is to assess and reframe. So we want to understand what the issues and opportunities are in the communities that we're working with, and then help them develop goals that they're going to work towards at their workshop. And what we do as part of this phase is we hold 3 phone calls with them, and we have them complete a community questionnaire that sort of helps them gather a steering committee and gives us some information to work with and to think about. The second phase is to convene and rethink, and during this phase we will visit each community for a 1.5-day workshop. During that workshop we have a few different events that I'll discuss in a little more detail in a moment. And the outcome of this phase is a set of community developed actions to achieve the goals that we developed in phase 1. And then finally, in phase 3, where we're thinking about moving towards action and implementation, we take the information that we learned in each community, we help them write an action plan, and they use that plan as a roadmap to work towards the goals for creating a healthy place. So some of the on-site activities that we conduct while we're there, we do a tour, which is a community-led tour, which helps us get a much better feel than, of course, we're able to over the phone for each of these places. It's very interesting, and probably, I think, my favorite part of the communities. We've seen some pretty interesting things in the 10 pilot communities that we visited just this year. We hold a community meeting or a public outreach event on the evening or afternoon of the first day. And then the second day is dedicated to strategizing and action planning. And that's when we really want to work with the community to figure out how they can develop actions to move them towards each of the goals that they've identified. And what we do for that is we help them define what actions they need to achieve. We help them understand why each of those actions are important, and if they can't figure out why they're important, then probably they don't belong in a priority sheet. We help them figure out who's going to take charge and who's going to be the champion of each action and help move it forward. And then we work to identify some resources and other places where they might be able to find implementation support for each of those actions. So our goals for the engagement while we're on site with each of these communities, there's a few different desired outcomes. Basically, what we're trying to achieve is, who's in the room. We want to make sure we're having a meaningful conversation and understanding the community's priorities from the perspective of all members of the community. The preparation work that we do is mainly with a steering committee, which is, of course, a small representation of the community. So we do need to confirm and vet what we've heard and to make sure that that is representative of the community at large. We want to make sure that we're planning with people and not planning for people. It is often difficult to get some groups of people to the table for conversations. So we try to work with communities where we're able to either take the conversation out to them or, bring them into events where they feel more supported. I will talk about that again a little bit more in a few moments. And then also, designing activities that sort of moderate, the usual suspects. We all have attended community meetings and public engagement events, and we know that there are often individuals or groups of individuals who can dominate conversations. And while it's very important, of course, that we hear their point of view, sometimes those dominant voices crowd out the quieter voices. So, we try to make sure that we include a variety of different types of activities and engagement exercises that tap into using feedback from, or getting feedback from all members of the community, even the ones who maybe don't want to stand up and say something in public. We make sure that they have opportunities to write something down or say something in private. So when we're thinking about designing this outreach and then integrating the feedback that we've heard, we make sure that we consider the size and resources of the community. We want to make sure that their expectations match what they're able to provide. We think it's about the time scope of the strategies. These technical assistance programs are designed to be quick hit and short term. We're talking about actions and goals that should be achievable in 2 to 5 year time period. So we want to make sure that we're designing actions that have a realistic scope. And then resources. What does the community have? Do we have the right people in the room to make sure that we can sort of tap into the potential of the community? And where else can we look if we don't have the right pieces in play? And then culture. Every community is quite different. And when we're thinking about how to engage participants and residents, we need to make sure that we're engaging them in a way that they will respond to. So for instance, one of the communities we worked with this year was a small neighborhood in Los Angeles that is 80% Spanish speaking, and we learned right away that a sit-down style community meeting where people came into a room and watched a presentation was not something that was going to work for this community. So we knew that we had to step outside the box a little bit, and we ended up designing and facilitating an open house. And people were able to come from the community, and lots of different community partners participated, and it was overwhelmingly successful, and in a way that would not have been the case had we just asked people to come and sit and listen to us talk about a PowerPoint. So now I'm just going to give a high-level summary of 3 of the 10 pilot communities that we worked with and talk about some of their early wins following the technical assistance and workshops. Just sort of for context, all of the communities that we worked with, we visited between June and October of this year. The last one was, I believe, the 3rd week in October, and that was Bangor, Maine. So these are all still pretty recent. And, they're still working on a lot of things, but they've all managed to achieve something pretty significant, even if it was 2 or 3 weeks ago, which we're pretty excited about. So Waterville, Maine was our very first community that we visited. Waterville is a small city in mid-Maine. This particular project, the applicant was a group called Healthy Northern Kennebec, and they are a group that's attached to Maine General Hospital, and they're focused on community health. So for their project, they wanted to bring together the variety of health partners in the city. They had a local college, and they had a pretty active city government, and how they wanted to make sure all these partners were working together to enhance access to food and access to healthy living for all the residents in Waterville. So the goals that we helped them develop prior to the workshop, we're looking at partnerships, we were looking at access to affordable and healthy food, looking at integrating active living into ongoing downtown revitalization efforts, and then also supporting economic development through the natural resources and recreational resources and assets that the community already had access to. So early wins and some key outcomes for this particular community, one of the things that they really wanted to do was make sure they developed some new partnerships and connections, particularly with the Chamber of Commerce and some of the economic development folks in the community, and they have really managed to make that happen since we were there in June. They've been holding monthly meetings since the workshop, and the economic director and the dean of the college have all been to these meetings every time. So they're pretty excited about that. And they've also been hosting a 100-day action lab. So in the 100 days following the workshop, they wanted to induce their participants to keep the momentum preserved and moving forward. So they are making sure that everybody takes a little bit of responsibility for an action and moving it forward. Another community that we worked with is Powell County, Kentucky. This county is located in east central Kentucky and has two main cities, Stanton and Clay City, both very small communities. This particular project was led by the Kentucky River Foothills Development Council, and they're a group in this county that provides a lot of social services and healthcare services to residents that don't have a whole lot of options for healthcare access. They're pretty isolated. They don't have many options for transportation. Like many communities in Appalachia, they have some pretty significant substance abuse issues that they're trying to deal with. They have some problems with homelessness, and then they also have some significant health-related issues such as obesity, cancer, high rates of diabetes, and other things of that nature. So for their workshop, what they wanted to try to accomplish was to develop strategies to improve access to healthcare and active living facilities. They wanted to develop new connections to try and link their healthcare partners and their economic development initiatives. They have a pretty robust tourism sector in this particular county, so they wanted to try to maximize what they were doing with both of those, around both of those, to sort of take advantage of the synergies between outdoor recreation and healthy living. They wanted to increase their collaborations throughout the community and try to approach things from a more holistic perspective. And they want to try to develop a community health and wellness plan that can help coordinate partners around their key health and wellness initiatives. So they've been super busy since we were there in early October. They were very inspired by the case studies that we shared with them, and they've been making a lot of connections with some peer communities, such as Williamson, West Virginia, that Stephanie spoke about. They're trying to make a visit to Forest County, Pennsylvania, to learn about a effort there where they created a pop-up market square after following a fire in their downtown. They've attracted the attention of a former congressman who now runs a health foundation in the state, and he's going to be joining their next call and is pretty excited to be part of the committee to help move these projects forward. And they've also formed a group to work on their farmers market, which is existing, and then now they want to implement a fruit and veggie prescription program to both supplement their farmers market and help improve healthy food access for their residents. So this was the Pico Union Westlake neighborhoods in Los Angeles, California. This was the community I was speaking about earlier who felt they would not respond well to a community meeting style situation. So this particular neighborhood is located just northwest of downtown Los Angeles. They're facing some pretty severe gentrification pressures. They have some extreme issues with violence and gang-related activity in their neighborhood. It's a high immigrant population. 80% of the residents there speak Spanish or another Central American dialect. The community is afraid. They're afraid to leave their homes. There's a lot of safety issues, and what we discussed with them and the strategies that we helped develop were a lot of them were focused on alleviating those fears and figuring out ways to sort of take back this community for the people that live there. So this project was led, the applicant was a group called New Economics for Women. They're a nonprofit capacity building organization located in the neighborhood. And they have a building called the Prosperity Center, where they have a federally qualified health center, they have a charter school, and they offer a lot of job training and financial development programs for the individuals in the community. And they also have an arm of their organization that provides affordable housing. So they really kind of do it all. So their goals were to, they're redeveloping their building. And they wanted to reach out to the community to make sure that they understood the needs of residents. What residents want there, what type of healthcare services they need, what other supportive services they would like to see in that type of building. Another goal was to create safe access for the neighborhood residents. There's problems with them walking down their streets. You can see on this top picture here, we asked them to place red dots on places where they did not feel safe in their neighborhood, and you can see that there's entire streets that, you know, people just don't go down, basically, because they've been claimed by individuals and groups of individuals. So, and then finally, they want to create new partnerships between the different neighborhood stakeholders to support healthy places for healthy people goals. You may have noticed, I think we've all touched on it a little bit, but developing partnerships and supporting partnerships and creating new partnerships was probably the major theme, I think, of this pilot round, and was something that pretty much every community we visited, that was one of the main things that they wanted to focus on. So some early wins and key outcomes, we were pretty excited. We just got a few emails from our main point of contact there in the Pico Union Westlake neighborhood. And they let us know that they've already scheduled a Clean Streets Initiative event that's coming up this weekend for Whitmer Avenue, which was one of their identified priority sites that has had some pretty serious problems on it. They took those maps that we developed with the red and green dots to the police station and the neighborhood council, and they're using those as a guide to help them figure out ways to take back those streets, but in a way that is sort of less aggressive than they've been pursuing in the past, because I guess what happens is when people are reporting problems, there are some issues with the residents then get pushback from these individuals, and by sort of using cleaning up the streets as a way to improve safety, it's a less obvious attempt to sort of improve safety. They're making sure that they connect with all of their stakeholders after the workshop to make sure that their momentum keeps moving forward. In this picture here, the open house that we conducted for this community had one station called A Kid's Life, and we had them draw some pictures. And this one here is, it asked children what your favorite healthy food was. And you can see a lot of kids liked watermelon and apples and bananas. Someone wrote kale. We're not really sure if that was a kid or not. But it was really, really great to see what these kids wrote down, and they drew pictures of places they felt safe, places they like to play, and it was a really great way to engage with a section of the population that we don't typically engage with at our community events, because they're at night, or they're a meeting that a kid probably wouldn't want to sit down and listen to a PowerPoint presentation. So just thinking at a higher level, we've managed to develop some strategies for very specific place-based projects, but we've also figured out ways to address larger community needs. We've helped communities make new connections to build their capacity. I think we have a new recognition now of the role that healthcare partners can play and their importance in the community, and what they can do when they sort of step outside the box of being just, sort of what we would consider the traditional role of a healthcare provider as the physical body, because I think that they are starting to realize that they can have a much bigger impact on the places where their facilities are located. And then so many of these action plans that we've helped develop are already moving forward, which is really promising. And then key takeaways, our workshops, that's really the spark that gets these efforts going. I often tell people that if there's no other outcome other than just getting all those people in the same room at the same time, that's a win. So chalk that one up in the W column for yourself. And, because people often sort of silo themselves and think that they don't have things in common. And then they sit at the same table as someone and realize they're working on something really similar. Or, they have resources that can be shared or something like that. And, you see these really amazing connections take place. We've helped, these stakeholders and healthcare partners just see that facilitating this relationship building is really critical. Healthcare partners are sort of being put in a role that they don't typically play in this type of workshop. They're not planners for sure, and you can see that as a planner going in to facilitate an event like this. So there is a bit of prompting that needs to happen, but once people are together, I think that's where the magic happens. And then use a holistic approach. We've sort of developed this medical themed values, vision, and issues. Listen, diagnose, identify your treatment, and then figure out how you're going to prevent these things in the future. But overall, it's been a very rewarding and promising round of pilot communities. So our contact information is here. I'm sure this will be also available as a PDF, the presentation, and a recording is being made of this webinar today. And we just wanted to say thank you so much. And there's going to be some question and answer time available right now.
Great. Thank you, Caroline, and thank you to all our presenters today. It's a very exciting opportunity to actually work with our partners at EPA and the Office of Sustainable Communities. So we've gotten a number of questions that were submitted during the presentation that we are going to go through and ask the presenters now. But if you do have other questions, you can still go ahead and submit them to us, and then we will be able to ask them as well. So I will try to direct some of these questions to the team of presenters. In some cases, they were asked of specific individuals, but if others wanted to add some comments as well, that's fine, or if others are better suited to answer, please do just chip in. So I'm going to start kind of at the end, I guess, with Caroline. It sounds like, and this is the question here, it sounds like capacity building is key to the success of these pilot projects. Do you have any recommendations on getting technical assistance to get people organized and sustain the organization?
Yeah, so I mean, people do always ask us, what do we do next, right, when we leave? Because as a contractor to EPA, our involvement does sort of end, once we hand over that action plan. So the communities that are most successful that we see are the ones that are able to keep that organization together and meeting regularly and moving forward. And to me, it seems like, having a dedicated group who meets at, I mean, it sounds simple, but who meets at a dedicated time and a dedicated place, to make sure that, I mean, we're all very busy and it's hard to, things slip by very easily. But if you know that you have that commitment, and then that's the thing that you're going to be focusing on, I think that's very helpful. We do ask that our communities form a steering committee for these projects. So often they will choose to keep that particular group together. We do help them determine who might be the best fit for that steering committee as we help them get started on the technical assistance. So, we do often give suggestions and things like that. Kate, did you, or Alana, or Steph, did you have any ideas about that? How to keep the momentum going for?
Yep, this is Kate. I just wanted to add to that. I think a couple of things just jump out to us when we leave these communities and, you know, they've got this action plan in hand. And I would say that oftentimes they will stay together as a group if there is a very tangible project that they've identified that is, you know, something that's going to require some joint funding efforts or that sort of thing. So having a specific project focus tends to help. The second thing is often a organization will kind of become the sponsor for the effort. And what I mean by that is, in the case of the LA project that Caroline presented on, which I was also a part of, you know, the nonprofit organization New Economics for Women really became the owner of this topic, and they are going to then kind of be the ones, I think, that continue the convening with the other neighborhood partners. So one thing to think about is, in terms of that capacity building, is thinking ahead, you know, for this program in particular, are there some organizations that this kind of topic area can nest into as a move forward strategy? So I think those are the two things I just wanted to add.
Great, thank you, Kate. So to move on to the next question, is there a typical size of community that makes a good fit for this program?
I can take that one. This is Steph. I would say that we work in communities of all sizes. I think for Healthy Places for Healthy People, what we're oftentimes looking for is a community that has a sense for where they might want to go, but haven't yet figured out all of the details. And so there's sort of, I think, a sweet spot where our particular assistance model is helpful, and that's where you have a steering committee of organizations that represent the interests in the community that want to work on these topics, but they haven't figured it all out yet. So I don't necessarily think it's a certain size. I think it's more in terms of where you are in your process and whether this particular, you know, convening, this model of having a 2-day workshop in your community, having some access to experts in this field, and, you know, to get the momentum going, if that's a good fit for your community.
Okay, as kind of a follow-up to that, we just got a question in asking if there are any handouts, one-pagers, or media type of links that someone could present to a city council or administration to get them interested in a program like this.
That's a really interesting idea. We have our Healthy Places for Healthy People website, which has some information about the program. We haven't developed exactly something like, you know, media materials or something like that, but we are, now that we've completed our pilot year, are thinking about what kind of materials would be helpful to other communities who might want to engage in a similar effort. So those are good ideas for us to keep in mind about, you know, what we could potentially produce moving forward. So I appreciate the suggestions too.
Okay. Another question is, does EPA conduct check-ins with steering committees to assess progress or to help to keep the project on track?
Yeah, so I can speak to Healthy Places for Healthy People, but also our other technical assistance programs. One that I mentioned briefly in my remarks is our Local Foods, Local Places program, and this is a program very similar to HP2, but focused on helping communities leverage the power of local food systems to revitalize their downtowns. And Williamson, West Virginia, one of the communities that I mentioned, was a Local Foods, Local Places community a couple years ago. So we do keep in touch with our communities. Obviously, we've just finished our workshops for HP2 this round, but we at EPA do keep in touch with our communities, and we help encourage you know, them to communicate with us so we can learn about how they're doing with implementing their plans. So I know I continue to hear from communities that I've worked with years ago, and that's an important part of the process for us because we want to learn how our process has helped them, but also to inform case studies for future work. I think oftentimes the communities where we work become the next great success story, and so we do keep in touch with our communities for that reason too.
Good, good. Okay, here's another question for you, Stephanie, that I think was from earlier in the presentation when you were talking. Can you provide more information about federal qualified health centers? What is the difference between them and other hospitals, and do they have a broader mission? And I guess related is, should communities try to establish this type of health center in their community?
That's a really good question, and we should have given more background on that. But federally qualified health centers are a specific designation, a kind of community health center that receive federal funding from the Department of Health and Human Services, specifically from the Health Resources and Services Administration, which I mentioned as a partner who's been very involved with us in the HP2 program. So there's a very specific definition of what an FQHC is, and you can actually go to the HRSA website to get that definition specifically. But basically, it's a community health center that serves a designated area that is medically underserved. So it has to be a region that doesn't have adequate healthcare services provided to the community. There are other requirements as well, but they do receive federal funding to support their efforts. And federally qualified health centers tend to be very focused on not just healthcare provision, but also on broader community and economic development activities, which is, I think, why they are such an innovative and a good partner for communities to look into. There's also maps of where your FQHCs are. It may be that you have an FQHC in your region that perhaps you didn't know was an FQHC. So HRSA's website, which perhaps we can work with Michael to provide the links to those in some of the follow-up materials, would be a really good resource to look into whether you have an FQHC in your region, and the information on exactly how to get one started if you're interested in one.
Yes, we will do that. In fact, a number of people have asked if we will be uploading the presentation, and we will work with Kate and the team to do that. And any other information that they think is relevant, we could certainly add to our webinar page. So we will send out a notification via the website later in the week once we have all of that up there. So thank you. Okay, to transition a little bit, maybe this is a question for Elena. What is the role or roles of schools in health planning, both as institutions of learning, but also as school facilities themselves in these types of efforts?
Well, we've worked with schools in a few different communities, and I think their role is understanding that, you know, they know that they're not only providing education to children, but they're providing a safe place for many of the kids to be. They're providing food, and hopefully healthy food. So there's a lot of different ways that schools are involved in this health planning process. And we actually, in our Greensboro, Alabama workshop, we had the principal of an elementary school there for our entire workshop. And, you know, she was wanting to integrate the schools into all of the health planning ideas that we had in terms of educating on resources and things like that. So I think there's also, especially regarding food, that's, I think, really a key part of where schools can plug into health. And whether it's through, there's a USDA Farm to School program that benefits local farmers as well as provides healthy food to students. There's also these models of schools that are called community schools, where they provide a resource hub for not only their students, but also the parents of students who can come into the libraries and access computers if they don't own one, so they can apply for jobs or just have other resources available to them. So I think there's a lot of opportunities and a lot of ways that we've seen schools be plugged into things outside of just providing education.
Yeah, if I could just add to that, Alana, I think the other thing is, you know, our schools were one of the early partners in really advocating for safe, walkable access to schools. And so if you link kind of the Safe Routes to School kind of initiatives back to a larger healthy community initiative, I think you can, you know, that's a good way of framing the potential partnership with the school district in particular too.
This is Steph. One other thing that I would just add in to what Alana and Kate said is, for some of our workshops, we've seen school districts and individual schools be a part of the process in a really integral way. In Monette, Missouri, which was one of our communities this round, the school district was part of the steering committee. And at the workshop, an entrepreneurship class at the high school actually sent, I think, 4 high school students to the workshop. And there's an entrepreneurship link here too. In a lot of, especially the smaller towns and cities that we're working in, a big challenge is losing young people who are moving away, and you hear the concept of sort of brain drain, and that's not good for the health of a community either. And so it really heartens me when I've seen communities that we've worked in involve young people, involve the school system, and involve particularly students who are really interested in becoming entrepreneurs in their community and becoming community leaders, be part of the workshop. So we really try to encourage young people to be part of our workshops as well.
Great, thank you. So in a related vein, and I'll just put this question out to the panel, are local health departments' community health assessments a starting point for the steering committees to pursue healthy places? And what data should a community examine to determine which direction a healthy places program should go?
Yes, we didn't mention, this is Stephanie, we didn't mention the connection to community health needs assessments, community health assessments that are done, either by public health agencies or by nonprofit hospitals. Not many nonprofit hospitals have a requirement to conduct a community health needs assessment for their population as well. And that is oftentimes a really great starting point, particularly if you have one for your community, for your region. And we've certainly looked at the community health assessments that were part of the communities where we worked with this year as sort of part of our baseline information. I think some communities, including Bangor, Maine, one of our pilot communities, are thinking about how to work together as a region to do a joint community health needs assessment, and that can help bring all of the different stakeholders together to work on these issues holistically as well. So this definitely came up in a lot of our communities. I think they're a tremendous opportunity to better connect improvements to the built environment with the health outcomes that many community health needs assessments are identifying there's a need for.
And I'll add to that too. This is Alana. As far as the community health needs assessments go, nonprofit hospitals are required to conduct them, and many times they help to pinpoint what are those really critical health issues that a community is facing. And so if the community is really strapped for their ability to focus on a whole bunch of different things, if they really want to hone in on one certain area, they can use those health needs assessments to really pinpoint, okay, what's maybe the one place, one thing that we can focus on to work towards improving health and health outcomes around this one key area. And then maybe we can see what happens with that, and then we'll potentially be able to move on to the next area.
Excellent. So in a related vein, in terms of partnerships, there have been examples about getting the private sector involved in the healthy place planning, and if so, how?
I'll jump in real quick and just, because I think this is another kind of theme that really came up this year in terms of many of the communities that we work in were distressed kind of rural areas that had lost or were struggling with kind of their economic development and their job base. And that really drew the attention of the chambers of commerce and the economic development folks, which is if they don't have a healthy community, meaning a healthy workforce, they can't attract jobs. And so that, I think, is probably the most tangible example that I can recall. I know not part of the HP2 program, but in Albany, Kentucky, we did a local foods, local places delivery, and sure enough, one of the major employers in that area really had become a partner in that community to help address the opioid crisis, to help become a player in supporting a more, healthy workforce. So I think the sector that's related to what does it take in our community to kind of have the best workforce is potentially an angle to engaging those folks in this larger conversation of health.
And I can add to that. This is Steph. one of our HP2 communities this year, Monette, Missouri, had very strong participation from the business community in that workshop. It is actually a community that has a lot of jobs, and people are actually commuting in from other regions to this small city for the jobs that are there. And so in Monette, the businesses in the industry that was there really wanted to come together and work with the hospital, to work with the city, to work with the school district to make Monette a place that would attract people to live there, because they saw the benefit of having their employees able to and wanting to live in the community. So that's another example from this round of HP2 where certainly many employers are seeing the need and wanting to participate in creating really vibrant places, because they know those are places that they'll be able to better recruit and retain employees. This is true for hospitals, by the way, as well. Many hospitals are seeing that they are better able to attract doctors and nurses and other employees if their community is one that will make them competitive. And so it's definitely a trend that we are seeing in our communities as well.
Thank you. So actually a question that I think is related to that answer was asked as well in terms of our health insurance companies partnering in this planning, and if so, how?
I don't think in this round that we saw any health insurance companies as active participants on the steering committee, but I do know the pharmacy program that I referenced. In that case, the federally qualified health center that was administering this pharmacy program, they got their funding from a health insurance agency to be able to provide those stipends to their patients to then go redeem at the farmer's market, because the health insurance agency saw it as a benefit to them too, because if the patients are having healthier lifestyles, living healthier lives, better health outcomes, then they're paying less money, and it's improving their bottom line too. So there are some health insurance companies out there that are starting to see this as well.
Okay. So here's a question that was addressed to Caroline, but maybe others can also add to it. Funding for staff and projects is critical to ensure the implementation of plans. What approach is best to help communities succeed in obtaining adequate funding and staffing to ensure the implementation of these plans?
Sure. So part of the approach for these technical assistance programs, and part of why they work so well, is because EPA, sort of behind the scenes, also acts as a coordinator of other federal agencies that are either formally part of the programs or are not, but just we have connections with. So what we typically will do is when we, after we develop the action plans, or even during the workshops, we will either invite federal and state and county representatives of different agencies and organizations to attend the workshops, which is great if they're able to do that. If they're not, we invite them to participate on our steering committee phone calls, or even just review the action plans after they've been created, to identify resources that their organizations or agencies might be able to provide to help implement some of the actions that have been identified in the plans. And then I'll add, go ahead.
I was just going to say, one of the other kind of key things, I'm sorry, this is Kate, about this program in particular is that behind the scenes we call it quick hit technical assistance. And part of the reason for that is that the action plans are actually built around giving these communities something they can achieve within their existing resources, meaning there's always, the need to kind of, especially if there's a project that they're trying to fund or something like that, but the local capacity building of just helping people to figure out how do we advance this kind of idea of health in our community within our existing organizations, within the existing resources we have. And because of that, the action plans, they tend to be scaled to something that community kind of knows. They don't have to necessarily you know, develop a whole new funding mechanism to do everything in the action plan. There certainly are going to be some of those items, you know, that are identified, but one of the key things that we really try to do is tailor that action plan to the capacity that's on the ground today, and then kind of give them a framework for how they might build that capacity up over time. But, you know, what we don't like to do is kind of leave them with something that then, you know, they can't get to for 2 or 3 years because they don't have the budgets in place yet.
And I'll add just a little more to that. This is Alana. I think one of the most important things that comes out of these workshops, or that happens at the workshops actually, is the convening aspect of it. And so you bring all these different people together who might not know the other person exists, but they're working on similar programs or projects. And that's why we keep highlighting that partnership piece too, because it's knowing what's out there, what's going on in your community, what are the different programs or projects going on, how can you build some partnerships around helping to move these things forward or move these new ideas forward that are in the action plans too.
Okay, thank you. So just as a final question, and there was actually a few related questions that were sent in, but I think you'll get the sense of it from this one. Is there a link between wealth or conversely poverty and those communities where there is the greatest need for connecting public health and community planning efforts? For example, are wealthier, more suburbanized areas actually more sedentary, although the residents may nonetheless have greater access to health care?
I think this is Alana. As a whole, generally, I mean, I think that's a correlation that would make sense. But as a whole, if the wealthier someone is, the more likely they are to live longer and live a healthier lifestyle because they have access to a living wage job, which allows them to purchase healthier foods, have access to better health care, have access to a higher quality education, all those different social determinants of health. And so the more money you have, it's directly correlated with how healthy you're going to be.
Great. Did anybody else want to add to that in conclusion?
Well, I would just say that I think the reason why, however, wealthier communities as well as lower income communities, everybody's talking about this, and why I think this is such a critical kind of centering idea within city planning is because of, you know, what somebody was thinking, which is even in our wealthiest of communities, our sedentary lifestyles, the fact that many of our kids, even in the wealthiest of places, don't get to ride their bikes to school, all of those sorts of things, it is starting to creep into even the wealthier communities having health issues that otherwise they wouldn't have if they lived a healthier lifestyle in terms of more active living. So I wouldn't hesitate to say that this is a universal issue across many different income levels. Obviously, it's way more acute in areas where they're struggling with poverty. On top of it, it just amplifies the challenges in many cases. But there is also something about kind of our American lifestyle that is also at play that seems to cut across all of those income levels that I think is really relevant, and I think can be dealt with properly by kind of having this approach to what does it mean kind of holistically within our communities to try to achieve a healthy community.
Great. Well, thank you, Kate, and thank you everybody on the panel today, Alana, Caroline, and Stephanie, for participating in creating healthy places for healthy people. We did get a number of other questions that we were not able to get to, but we will be posting the webinar to the website as well as to YouTube in the coming days. I do want to give a big thank you to our presenters for the great presentation and for all of you who attended. When you exit from today's webinar, you will be asked to participate in a short evaluation. Please take a few moments to provide feedback so that we can continue to improve the webinar experience for you. And keep an eye on smartgrowth.org and our weekly e-newsletter for details on other future webinars. Thank you very much.